And as mentioned in the news there, that the mental health inquiry is out today. Well, not the mental health inquiry itself, but the government has given its response to the recommendations of that inquiry. And it said that fixing mental health services will take big money, but it has signalled that it will start that investment from tomorrow and tomorrow's budget. But today it announced it accepted in principle, or will give further consideration to 38 of the 40 recommendations from its inquiry into mental health and addiction. Now, that includes setting up an independent mental health and wellbeing commission. They'll also increase access to mental health and addiction services, and they'll establish a national suicide prevention strategy, but they won't adopt a suicide reduction target. And as yet, there are no specific details around funding. Now, Health Minister David Clark joins us now. Good evening, Minister.
Good evening, Lisa.
Just a point of clarification to start off with. You say that you've accepted in principle, or will give further consideration to. So are you going to do those things or not, of the 38 recommendations?
Well, those words mean what they say. Some of them we accept outright, the recommendations, and they just simply need to be implemented. Some of them are around accept in principle. For example, there's one recommendation which focuses on setting up a cross-parliamentary group. We see that as a job for the Parliament, not for the government, if we can make that distinction. And so we accept in principle that cross-party and cross-parliamentary work is a good thing, but we accept it in principle because it's not us as the government that would drive that kind of change.
Right.
And then further consideration means we think there's more work to do in that area. It's not something we're rejecting. We've been clear that there's 2 recommendations we've rejected. Others we are giving further consideration to.
So 38 of the 40 that you've identified today, around 22, I just did a quick calculation, around 22 either fall into that category of accepted in principle or will give further consideration. So what kind of guarantee that you will push forward with the majority of those?
Well, we will do the work that needs to be done. This is a government that's committed to taking mental health seriously. The resources in government have shifted so that we now have a mental health directorate in the Ministry of Health that wasn't there before, and that's building up. We are investing in addictions treatment. We're investing in primary health care. We are making investments in this area because we believe that transformational change is necessary. That's what the inquiry recommended.
Okay. I'm wondering also why you changed your mind on a suicide reduction target, because prior to the election, you categorically said that you would commit to a reduction target if you were in government. So what or who changed your mind?
Well, in government, the whole time we've been very clear that we think one suicide is one suicide too many. This is something that we have wrestled with extensively because this is a challenging issue. The evidence is not there to support a target to say that it makes a difference in and of itself. What does seem to make the difference is the resource and the commitment of government and the whole of society actually to make the difference that we need to see. So we went backwards and forwards on this. In the end, we recognised that we weren't actually going to be comfortable with any level of suicide. We think every life matters, and that means that we've got to commit to getting suicides down to no suicides in the longer term.
You're going to work on a national suicide prevention strategy. So how will you measure that success then if you're not having targets or reduction targets?
Well, I think people will make their own judgment on the investments we're making and on the suicide rate and whether we're doing the right things to bring that down. We recognise this as a complex problem. It's not something that's happened overnight, but it is something that we need to take seriously as a country. We need to commit ourselves to reducing suicide, and that urgent work on completing the suicide prevention strategy, I hope we'll see it finished in 8 to 12 weeks. I want to see that in place.
So in essence, you will be using those numbers, the suicide numbers, as a measure, even if you don't categorically state what your target is, won't you? I mean,
yeah, we believe every life matters. So I think those suicide numbers that we have in New Zealand are a national shame. I think we have to tackle suicide. We need to have strategies in place to do that. We also need to support those bereaved by suicide, those who are vulnerable, to make sure people are getting the supports they need to keep them safe.
So a mental health commission is going to be set up. You signalled today at your press conference that it will in essence be a watchdog to hold the government to account. So will you give them any powers to compel you in any way?
They will be look, I can't get ahead of the budget announcements tomorrow, and there is some further policy work to be done, but I expect to have more announcements to make on that by the end of June.
So, the money you indicated may be announced tomorrow for the Commission, but in terms of their authority or power, can you give us more detail on how much teeth you're going to give them?
Those details are going to be finalised in coming weeks.
Okay, so you have said previously that there is a 75% roundabout increase in demand for services over 10 years, right, for mental health services. So would you accept that given the kind of rate of increase that we've got for services, there's no way conceivably that you could keep up with that? Prevention has got to be a large part of this equation.
Prevention is a very important part, and currently we know that half of those people that take their own lives have never been in touch with mental health services. What we also know though is that I think the statistic is 44% in a recent survey had been in touch with their general practice in the prior year. So a lot of people are in touch with their doctors. They're going into primary care, and that is one point of access where we know those who are wrestling with distress, with anxiety, with depression, with mental health issues are making contact. We need to find ways of better supporting them in the primary care setting.
Yeah, I see a lot of mentions in your information release today about crisis service and increase to those kinds of services. So, as a split, what focus are you going to give on prevention? Because we've established you can't keep up with increasing demand at the crisis end of things. So where's the split in priorities?
Well, I think you'll see tomorrow in the budget a significant emphasis on the mild to moderate end. That's what the inquiry into mental health and addiction itself focused on. The first 12 out of the 40 recommendations focused on broadening access, making sure people could get the help they need before smaller problems became bigger problems. So that's firmly where we will be focused. But you'll actually see that hasn't come at the expense of investing in other areas either, because there are many things that need to be done better.
So in terms of access, again, the report said that we were giving access to about 3.7% of people who required it. The recommendation was maybe 20% should be the target. You haven't committed to an actual number. What should it be?
Yeah, there was no recommendation that specifically gave a target. There was a discussion of 20%. A suggestion, that's right. That because by some estimates, 1 in 5 people wrestle with mental distress in any given year. We want to be sure, really, that 100% of people that wrestle with mental distress have the supports they need, no matter whether they get that online through telehealth services at the local level. We are going to need to train a significant workforce. We're going to need to train peer support people. And we're committed to doing that because we actually want everybody who's in distress ultimately to be able to access services.
And I understand that as a principle, but to track how you're going, surely those figures would be useful. So we're sitting at about 3.7%. Why not set a target? I think further government investment will be needed over the years. We won't address everything in this budget, but I think people, when they come to the budget tomorrow, will see that there's a significant investment and that we've laid out a pathway that's credible, that's ambitious, but we make no apology for that, that actually starts to address that need. In opposition, you said there was urgency required around this, urgency, but you don't have these targets in mind. You're not revealing how much money is being spent. So are you giving that the urgency it deserves?
Tomorrow there will be plenty of information around the financial support. In terms of urgency, I don't accept that targets make for urgency. What makes for urgency is actually having a focused workforce that's appropriately resourced, and also changing the wider culture across our communities to say to people who are in distress, how can I help? How can I support you to get the help that you need when you're in this situation? That change is happening, but actually, as you've alluded to earlier, Lisa, the actual services have not always been available to those who've come forward for them.
We're almost out of time. Very quickly, of the 38 recommendations that you are looking at addressing, how many of those will be dealt with in the budget tomorrow?
I can't give you an exact number, but it's a substantial number.
Is there going to be anything for people's rotting teeth in the budget? You would appreciate that that's been a big issue over the last few days. Any promises that you can deliver us something tomorrow?
I won't be. Obviously, DHBs deal with the hardest end of that need, and there will be an increase in DHB funding. We've committed to funding DHBs more sustainably. But
anything ring-fenced for dental?
I won't be getting into any budget announcements now.
Thanks for joining us this evening, Minister. Appreciate your time.